We have a 9 News exclusive for you now, and a huge breakthrough for Australian medical research with the announcement of a $12 million biobank to be built at Royal Prince Alfred Hospital in Sydney. The biobank will store large numbers of stem cell samples, working towards improved treatment for diseases.
So often Australia waits at the end of the queue for a new treatment, a new drug to be refined overseas, and then finally our patients get it. Once we're part of world-leading and new research into these new technologies, our patients, receive these treatments earlier.
Narelle Fletcher has triple-negative breast cancer, a type that is more difficult to treat when surgery and traditional therapies don't work.
The cancer itself, as far as I understand it, is quite aggressive, and the fact that there is no targeted therapy at this point.
After analysing old tissue samples, researchers discovered that patients with triple-negative breast cancer could potentially benefit from a breakthrough immunotherapy drug, prompting a new clinical trial at Chris O'Brien's Lifehouse. It's a clear example of how tissue samples can deliver hope.
It can help us develop better clinical trials, help us understand better how to select patients for these expensive therapies, and make sure patients get the right treatment, not ones that aren't going to work for them.
Now the government has unveiled this, the state's new $12 million biobank that can store more than 5 million specimens for medical research. Construction has now begun.
Well, this puts New South Wales and Australia on the world map. We see this as the pathway to better treatments for our patients.
All of the retrieval of specimens is done using a computer, so we put the request in and out come the specimens.
The biobank will also store valuable information from healthy volunteers, including 3,500 blood samples from the country's largest ongoing study of ageing Australians.
Well, it's very exciting because at the moment there's nowhere that we can store large numbers of samples.
A much-needed boost that will undoubtedly improve lives.
Real hope and accessibility to local patients.